Mountain Park Health Center is a community health center, and we deliver primarily primary care, preventive health care services. In addition to that, we have integrated services, so we add important things like behavioral health services and dietitian services. We have pharmacy and pharmacists on our staff that help patients as well.
One of the elements of a new market tax credit is demonstrating community benefit. And although this is something that we think about with all of our projects, I think working in partnership with LISC really allowed us to push that idea a little bit further. Think a little bit differently about what the community benefit would look like, and also what it would look like specifically in Tempe.
We've been in Tempe for 12 years. We've had a clinic that's been hidden away in a medical office building, and we outgrew it. Didn't have any street presence at all, so we needed a new location. The location we chose at Broadway and McClintock had a lot of advantages. It was a large site, it had access to light rail, bus lines, and it really could become part of the community, a visible part with street presence.
One of the major pieces that we started with was a theme around a visual expression of health. So we wanted to create that and really build based off of that idea and theme. And so for us, really having 6.5 acres was a great opportunity to do something different in terms of adding some community benefit to the site, sort of pushing the envelope a little bit from past projects.
This clinic was a boat dealership in its last life. I think originally a lumber yard, but most recently a boat dealership, and we converted it into a clinic. So that kind of adaptive reuse we really like because it takes something that wasn't very attractive and makes it into a community asset. But it's also a project that's a great recycling project for the community. So instead of building from the ground up or tearing down a structure and creating all that waste that goes along with that, we're actually taking something and reusing all the parts of it that we can and creating something completely new.
We really went out and spent lots of time thinking about which stakeholders to engage, and this is something that we've done with other projects. It's something that we really value in the process of design. So we went out and worked with and partnered with the ASU School of Sustainability, worked with various neighborhood groups, worked with our patients, employees, and also various city departments to really understand what Tempe was looking for.
I think that's a really important part of designing a community health center because we strongly believe that people own what they help to build. And so we really wanted to involve them in the planning and design phase of this project. In this project, we learned that there was a lot of desire for outdoor space that could be used for all members of the family. The partnership with LISC helped us realize our vision for this community. It's a long process involving all these stakeholders in the design of a clinic. It requires patience from our funders as well because there are faster ways to design and build things, and traditional financing would probably have less patience for what we do. But because we were working with a partner that understood what we were doing, that shared our vision for improving the community, it just felt like a very natural partnership, and it worked really well to get the best possible outcome.